Hi, I am Bruna. I'm a vet PhD student at Federal University of Paraná in Brazil. And my presentation is about comparison between the ISI methodology and measurement of intestinal villi in broilers. So before I start talking about the methodology, I'll explain a little bit about the structure of the villi. So in the intestinal villi, there is the lamina propria. The lamina propria is formed by blood vessels, fibrin, and this is the first access, defense access the bird, so it's possible to observe some inflammatory cells as well. And around the lamina propria, there is the epithelium. In the epithelium, it's possible to observe other cells like lobate cells, cells responsible for mucus, and enterocytes. The enterocytes are responsible for nutrition absorption. So it's possible to observe some other inflammatory cells as well here. So knowing this, I will show to you this image. This is histological image for intestinal villi in broilers. And I would like to show to you that we have two villas, and this first one and the second one, they are almost the same height. But the first one, all these purple points that you are observing is inflammatory cells. So the first one, there is a high score of inflammatory cell infiltration in lamina propria. And the second one, low score about the infiltration in lamina propria epithelial in lamina propria thickness. So knowing this, of course, the first one, it's a villus with more compromised compared to another one, because all these proliferations could compromise this villus. So evaluated only the villus high, maybe not enough to analyze it, the villus of about the healthy or functionality. For this reason, we are applying the ISI method, the ISI inside method. It's a scoring method. We evaluated some other parameters, histological parameters like lamina propria thickness, epithelial thickness, proliferation of enterocytes, inflammatory cell infiltration in epithelium in lamina propria, increase of globate cells, presence of emiria, and congestion. So we put for each one of these parameters evaluated, we evaluated according to scores. So the scores are provided for each one of the lesions according to intensity, extension of any one of these lesions. If the scores is 0 to 3, 0, no lesion, 3, highest lesion found. So another differential of this method is the impact factor. So besides the scores, each one of that parameters that I told, there is an impact factor. This impact factor is according to the loss functionality of each lesion founded. So for example, the presence of oocytes. The oocytes, it's knowing that coccidiosis causes gut inflammation, and this has a big impact in performance in the bird. And for this reason, the presence of oocytes has impact factor 3. However, on the other hand, epithelial thickness has impact factor 1, because not necessarily the epithelial thickness is related or linked to some inflammations. So when we have this information, the IC total is the sum of all that parameters that I'm told, and the scores 0 to 3 is multiplied for impact factor for each one of these histological parameters. And then we have the easy total score that I show the results for you. For spot cells analysis, the measurement of villus height and cryptodid is not a complete methodology for evaluation of intestinal health of broilers. Villus width is correlated to inflammatory parameters, and the ISI methodology is completed and more reliable tool compared to measurement of villus height and cryptodid. So as objective of this study was to compare the classic morphometry of intestinal villi with the ISI method. So this study was performed in Canada, was applied using 720 rows male broiler chickens, housed 1 to 35 days of age, and the animals are distributing 24 boxes, 12 boxes for each one of the treatments. So the treatments were divided into challenge with anemia and no challenge with any challenge or product. In materials methods, all the birds are housed in new litter. They are access a nipple drinking, control temperature, comfortable according to this height, and feed and water libido. And the diet was divided into phases. The first phases was starter, 0 to 21 days of age, and grower, 21 to 35 days of age. The challenge, so all the group that received the challenge receive inoculation in the feed dosage of 200,000 oocytes produced from oocytes isolated in the field. These oocytes, 80% was Emeria cerevisiana and Emeria tenila, and all the challenge was done at 70 days of age. Necropsis was performed at 20 days of age, 1 bird per repetitions, and euthanasia for all these birds by cervical dislocation for the jejunum sampling for histological analysis. For histological analysis, all the tissues was collecting for formulating 10%. The slides were processed and stunned with hematoxylin eosin, and all the slides were scanned to analyze it in this program, Ontario Image Scope program, because in this program it was possible to evaluate it the same villus that we applied the measurement. It was possible to apply the ISI method. So was evaluated 10 villi per bird in a total 120 villi per treatment. And for the villi measurement was analyzed villus high, villus width, crypto depth, crypto width, and the ratio of villus rise in crypto depth. For statistical analysis, all the data was submitted to Shapiro-Wilk and was applied Kruskal-Wallis to analyze it, and was done sperm correlation for performing the ISI scores compared to measurement of the villus. To the results, as expected, both groups present different results. The non-challenge group present higher. All the data was present statistical analysis in results, statistical results. So the villus high present higher results in non-challenge group compared to challenge group. The non-challenge group present low villus width compared to challenge. Even the crypto width, the non-challenge group present low results compared to challenge group. And the relation between villus high and crypto width, also the no-challenge group present higher results compared to challenge group. In the ISI method, we analyzed the lamina propria epithelial thickness, the proliferation of enterocytes present better results in no challenge. So lamina propria, epithelial thickness and proliferation of enterocyte was lower in no challenge group compared to challenge group. Epithelial inflammatory cell infiltration epithelium and lamina propria in presence of oocytes, of course, no challenge group represent no presence of oocytes compared to challenge group. So the challenge group present all these are presence of oocytes. In the sum of all parameters, the non-challenge group present better results compared to challenge group. So less lesions compared to challenge group. And also when we apply the correlation of Spearman, it's possible to observe that the parameters related like lamina propria thickness, epithelial thickness, proliferation of enterocytes, inflammatory cell infiltration in epithelium in lamina propria are strongly correlated with the villus width. So as final consideration, the results suggest that the broader contact surface ineffectively may result from the increase of inflammation by emeria, reduce intestinal absorption functionality. And as conclusion, a larger contact surface not necessarily is better intestinal function because could be compromised by inflammatory proliferation. And this pathologic scarring, it's important to detect the biological differences in treatments, providing more information about the gut health. So all the hypothesis that I told is true, is correct. So I would like to thank you for all watching my presentation and the PSA for all the support. Thank you.